Hi, this is Dr. John Yim. Today I'm talking about the esophagus. This is the tube that carries food and liquid from the throat down into the stomach. Now, the esophagus is very prone to one condition that many people suffer from, and it can be called heartburn. Some people call it reflux, and the medical term can be gastroesophageal reflux disease. Basically, what that means is that acid is escaping from the stomach and entering the esophagus. Now, at the top of the stomach, or the bottom of the esophagus, is a valve that's called the lower esophageal sphincter. This muscle relaxes when you swallow food and liquid, and it should snap tight afterwards to keep the contents of the stomach and the acid in the stomach. Unfortunately, there are different conditions that can allow the valve at the top of the stomach to become more relaxed or loose, allowing acid back up into the stomach. And that's what causes reflux. Generally, reflux is treated by, average person would take antacids, things like Tums, Rolaids, Gaviscon. Medically, it would be things like pantoprazole, which is a proton pump inhibitor. So the goal of these medications is to either neutralize or block acid production. Now, we know that that's not smart because we need stomach acid to digest our food and also to absorb minerals and B12. So blocking acid production interferes with the proper absorption of your food and the digestion of your food. So smart thing to do is to try to figure out the cause of the heartburn. Oftentimes, it may be the type of foods that you're overindulging in. Things like coffee, alcohol, can actually loosen the valve at the top of the stomach. Food allergies. Some people, it's not eczema or loose bowels. It could be relaxation of the valve at the top of the stomach, allowing acid to get back up into the esophagus. Stress can be a factor. It's not the only factor, but the digestive system works best when you're in the parasympathetic state. But when you're under stress, you're in the fight or flight or sympathetic state, and digestive function does not work as well when you're in fight or flight. So anything that you can do to help decrease stress and to calm that fight or flight state improves the function of not only the valve at the top of the stomach, but digestive function overall. So it's a really good idea, if you're suffering from reflux, to work with somebody to help determine the cause of the problem rather than just trying to medicate the symptoms.